Hello everybody. Today I'm going to talk a little bit about scarlet fever, which is now spreading a bit in the UK. So I thought it will be good that we can discuss about it. So what is scarlet? As a parents at carer, I know we will be worried and you need to something about it. So what is scarlet fever? Scarlet fever is an infectious disease. It is an infectious disease. This is caused by bacteria. And this is most common in the winter and spring and takes 2 to 5 days that infection shows the first symptoms. So it can be incubation period from 1 day to 7 days. What are the symptoms? You will see that sore throat, headache, fever, nausea, vomiting, and after 12 to 48 hours, characteristic fine red rash develops. If you touch it, it looks in a feel is like sandpaper. It is typically in the chest and stomach, rapidly spread in other part of the body. On more darkly pigmented skin, it's very difficult, isn't it, to spot. Although the sandpaper feel should be there. Now, what are the further symptoms? Of course, there will be fever more than 38, maybe about 38.3 or higher. Then there will be white coating of the tongue, which peels off in few days, leaving the tongue looking red and swollen, which we call strawberry tongue. And the neck, you can find the glands, and of course, there will be tiredness and feeling of unwell, and there will be red faces flushing, but it will be pale around the mouth, and these flush face appear more sunburn in dark skin. And of course, sometimes you can see peeling of the fingertips, toes, and groin area as the rash fades. And if you think your child has scarlet fever, you should consult the GP. Now I'm going to show you some of the picture of the rashes and things of scarlet fever, so you can have some glimpses what it is. So you can see these rashes of the first scarlet fever is like this. The most characteristic pattern is this sandpaper. You see this appearance, when you feel it, it is like sandpaper. And you can see I mentioned about the peeling of the fingertips in different part of the body. And of course, you can see this is flushing of the cheek, but this oral area, this is very, very pallor, yeah. And in the darker cases, darker shade, you can see some line in the creases that is called pastille line. And you can see throat is very, very red and congested. And I mentioned that initially there will be white tongue, spots of tabelis inside, but after 4-5 days, it will be like very, very red, absolutely strawberry looking tongue. So all these are very characteristic of scarlet fever. Now we have to know, how does scarlet fever affect? Most commonly seen between 2 to 8 years, people of all age can have this, but it is less common in adult. Although historically considered a dangerous disease, it is not that serious nowadays. Clears up after a week, but it is advisable to go to GP for diagnosis and proper treatment. So how it pass on is very infectious, spread by close contact, who carrying that bacteria. Spread via the mucus and saliva of the infected people. It can also caught by any drinking glass, plate, utensil they have used. So to protect yourself getting into illness, you have to wash your hand often. Do not share eating utensil with an infected person. Wash or dispose of handkerchief, tissues contaminated by infected person, and be aware that you can catch scarlet fever by inhaling contaminated airborne droplet. If someone with the illness coughs and sneezes in the air near you. Do you need any treatment? Yes. Very important that your child should get a full course of antibiotic. It usually 10 days, and they will be feeling better soon after taking that course. But you must complete the course of the antibiotic, so that you should not carry that bacteria in your throat. even after recovery. Mild cases can clear up on, but it is always better to check with GP. You should stay away from school, nursery, wherever for at least 24 hours after starting antibiotic treatment to avoid the spreading infection. Are there any special risk? It is mainly childhood disease. Around 90% cases occur in children under 10 years. Occasionally, outbreak can occur in nurseries and school. So that's all about, and sometimes there's some complication can happen that is not small risk of ear infection, throat abscess, pneumonia, infection of sinus, skin infection, joint infection, sepsis means spreading infection everywhere, meningitis, etc. And very rarely bone joint problem, liver damage, kidney damage, and heart damage. So it's very, very rare. So if you have suspect your child have this, please go to GP or contact NHS 111 and get the treatment as soon as possible. Hope this small talk helps. You will recognize scarlet fever symptoms and go to your healthcare professionals. Bye for today. We'll come back with another health topic next Thursday. Bye for today.